Hypertrichosis, also known as werewolf syndrome, is a harmless condition when abnormal amounts of hair grow on the body. It's classified by two types: generalized hypertrichosis and localized hypertrichosis. Generalized is when the hair grows all over the body and is way more common than localized hypertrichosis. There have only been 100 documented cases of generalized hypertrichosis so far. The rare skin disorder is congenital, meaning you're born with it. It has a dominant pattern of inheritance and is linked to chromosome X24 to Q27.1. The genetics of this skin condition is not yet fully understood because it is so rare. An affected female has a 50% chance of passing it on to her offspring, whereas the affected male will pass it on to his daughters but never his sons. There is currently no cure for congenital hypertrichosis, even though shaving will help. It can, however, also be acquired. For example, a hormone imbalance from drugs such as minoxidil, a medicine for preventing hair loss, can result in hypertrichosis. Hormone imbalances with testosterone or follicle-stimulating hormone, for example, can result in hypertrichosis. The drug-acquired hypertrichosis can almost always be reversed. It is also said to be linked to cancer and eating disorders. Some famous cases of this condition include Julia Prestana, also known as the Bearded Lady, and Supatra Sassofen, the Guinness World Record holder of the hairiest woman in the world. Epidermodysplasia verruciformis, also known as tree bark skin disorder, is a rare hereditary autosomal recessive trait. It's when the carrier has abnormal susceptibility to type 5 and type 8 HPV of the skin. The results are scaly macules, papules, and horns that grow mainly on the hands and feet. And HPV, also known as human papillomavirus, is the most common sexually transmitted infection. HPV is when a virus takes over a host cell and produces new viruses using the host cell's machinery. This means it is lytic. After the phase, the viruses can then attack other host cells, which is when the warts and abnormal growth start to appear. There are currently no cures found for epidermodysplasia verruciformis. Only one hospital cut off the quote horns on the hands and feet of Didi Kaswara of Indonesia, also known as Tree Man, and they grew back to the original length much faster than before, as in 3 weeks later. Though it cannot be cured, the condition can be reduced with the help of acetylcysteine and interferons taken with retinoids as well as cimetidine. The most famous case for epidermodysplasia verruciformis is, as mentioned before, Didi Kaswara of Indonesia, who is currently expecting death. Methemoglobinemia was brought to public attention when the Fugates, an interbreeding family in Kentucky, were recognized for their blue skin. Methemoglobinemia is congenital by the recessive trait for deficiency of the enzyme cytochrome B5 reductase, which is responsible for helping distribute oxygen to the body. When the enzyme doesn't work properly, methemoglobin cannot be released properly and therefore results in abundance of methemoglobin in the blood, which turns the cells blue. Type 1 methemoglobinemia, also called erythrocyte reductase deficiency, can be inherited by both parents and occurs when red blood cells lack the enzyme altogether. Type 1 isn't as serious as type 2, it just makes your skin appear blue. Type 2 methemoglobinemia is also known as generalized reductase deficiency, and it can be inherited by only one parent, and it occurs when the enzyme doesn't work anywhere in the body. This is also known as hemoglobin M disease and is caused by defects within the hemoglobin molecule itself. The results are catastrophic and seizures often occur. Patients often experience an intellectual disability and often die within the first few years of life. Though methemoglobinemia is congenital, it can also be acquired. In fact, it is more common to see the acquired form of this than the congenital form. Infants who eat too many foods rich in nitrites, such as beets, often get methemoglobinemia. It can also be acquired by taking drugs such as benzene and anesthetics. The diagnosis is simple and requires a blood test. For most acquired mild cases of this disease, no treatment is needed, and as long as the patient stops eating the food or taking the drugs, methemoglobinemia will often disappear on its own. If treatment is needed, however, there is medicine called methylene blue that can help treat the symptoms. Ascorbic acid can also reduce the level of methemoglobin in your blood, and hyperbaric oxygen therapy, a treatment often used for the mentally disabled, can also help methemoglobinemia.